Hey guys, wanted to let you know what's going on. This is day 3 of my top surgery, post-op. Um, it's sore. It's rough, huh?
Gotta drain them every 3 times a day, and I get to do it. It's not hard. All you gotta do is just watch his tubes. Just get a alcohol swab and hold it, push it down to his grenades, and then drain his grenades, and then measure how much fluid's in there, and then just keep an eye on what it looks like, if it's bright red or if there's any blood clots in his tubes. You gotta really work that out, otherwise he could get an infection.
Yeah, going all detail.
Mm-hmm.
First day was really rough. They had me on a lot of pain pills that made my head spin and stuff like that. So I got off of those, and since then I've been doing a lot better. Second day was kind of rough. My vest was super tight and was restricting my arm, and I think that had a lot to do with the pain in my arm. So we loosened up just a little bit, but after that it's been alright. It's just been, we've been sitting around trying to catch up on some Z's. Danielle's been going crazy with not sleeping because of me.
But it's okay.
Yeah, right.
Yeah.
Okay. Alright, hey guys. I wanted to talk a little bit more about, or I want to add to my third day experience with being post-op for chest surgery. When I started investigating to go to Medalie, he told me I have to have this vest, and so I bought this vest. You know, I did the right measurements and stuff, and it felt fine when I first put it on, so I thought I was good to go for my surgery. Well, now that I have had it on for 3 days, I realize that it's too small. So I recommend that even though it seems like it fits good, it's not too tight, not too loose, that you may want to go with a larger size, just one size up, because I'm having a lot of problems with it. I got a bed sore on the bottom part of my vest, where it rubs going to my stomach, to where it's bleeding. That's how bad. And then on this side, the reason why I have this cloth here is because circulation to my arm, it was just too tight, between the padding that they put on you that is literally glued to your skin, and the vest itself compressing, you know, all that pressure. I've had a hard time, so I had to I'll show you what I had to do. This is supposed to be down, you know, because it comes to here with the stomach, and so I had to roll this up, and on this side here, if you can see, I have a piece of band-aid here because it rubbed raw. So I had to roll that up all the way and just keep the compression on this part of my vest. And like I said, first day I had problems with this shoulder, and I did loosen it up because you have little Velcro things up here. But I did loosen it up because I had so much problem with my arm getting numb and stuff like that. So I had a really hard time with this vest, and that is just one of the recommendations that I recommended. You don't have to take the advice, but that's what I've noticed. And also with the drain sites, make sure that you keep extra foam around it. They didn't give me a lot of foam around my vest, so I had to put a little extra foam there because it was hitting, again I'll bring it down, it was hitting my tube. So I mean, I put a little foam on this side. Okay, it was up here. I pulled it a little bit and put it on this side, and then now I got this here to kind of cushion around here because it was hitting, this vest was hitting the actual tube. So now I got something there to hold it there, and not rub against the tube. So yeah, I highly recommend getting a larger vest than what they say to get. You know, they do say if it's too tight, get, you know, a size bigger if you're in between sizes. But it just seemed to fit right with me. You know, with binding all the time, it just felt right. It didn't feel too tight, it didn't feel too loose. I was, you know, having a hard time breathing. But now I wasn't thinking about all the foam they have, you know, here, and up into your chest. They have, you know, the foam from here all the way down to your stomach, and that put some extra thickness to it and made it really, really tight. So it just made me really nervous with a bed sore. I mean, if Danielle didn't catch it, I could have had an infection, really bad infection, after, you know, a week of having that and sweating under there and everything. So we fixed that, and then, you know, the circulation in my arm, that was not as bad of a problem because, you know, I just kind of loosened everything up and went to my primary care doctor and fixed that problem. But yeah, definitely go with a size larger if you have any questions about it. Alright, see ya.